And we're back on Spotlight on Air. Good day, everyone.
Hello guys, I'm Kat Kho, Kat mo, Kat nating lahat.
And I'm Patrick Ilao, aka Ang Liwanag ng Buhay, Ilaw ng Tahanan, and Pediatric Occupational Therapist. And welcome to Spotlight on Air, Episode 4.
Ayan. This episode is entitled Pediatric Practice Around the World. We have invited different pediatric OTs from different places to share their experiences about their respective practices.
That's right, Kat. I'm actually very excited to share with our listeners on what we have in store for today's episode, especially speaking as an occupational therapist working in Metro Manila sa pediatric setting. We went over how the pedia practice works in the Philippines and how it differs from other parts of the world.
Yes, ako rin. I myself am a pediatric occupational therapist practicing here in Mindanao, Philippines. So Patrick, marami tayong natutunan from our conversation with our guests. So here we go. Let's introduce them, no?
Yeah.
So starting off with our occupational therapist currently practicing in Australia. He graduated from the University of Santo Tomas. He has been a pediatric OT for 8 years. Everyone, please welcome Mr. Juan Miguel Ticsay, OTR, OTRP. Ayan.
Hello,
Good day,
sir.
Sir Miguel.
Hello. Yes, good day sa inyo.
So I would like to introduce the listeners to our next guest. She is an occupational therapist currently practicing in the United States at the Big Apple, New York City. She graduated and worked as a faculty member in Bellis College since 2012. She works in a school-based setting and at a skilled nursing facility. Please welcome Ms. Luna Alcaraz, OTR. Hello po, ma'am.
Hi.
Good day.
Good morning.
Good evening po. Nice
here
to
in
have
New York.
you.
And good morning there in the Philippines.
Yes po, it's nice to have you.
It's a pleasure.
Do you have, can you please share a fun fact about yourselves? Anything po.
Oh,
anything.
okay. That's why I love pediatric OT because I have 3 kids of my own.
Oh,
And my
thank
husband,
you.
who's also a kid at heart.
Kasali. Okay. Yan.
Sana po in
Okay.
the future kami din. Pati din ako sana kid at heart.
Oh,
Kid at
definitely. Sure.
Kailangan
Yes.
yata sa profession natin. So,
A fun fact about myself, I'd say I'm very passionate about music and art. And mixed martial arts.
wow.
Wow. Ako rin, sir,
Ano?
gusto ko rin ng music, pero yung music ata yung ayaw sa akin.
So, thank you. Thank you everyone for sharing those fun facts about yourselves. I would officially like to start our podcast. Can you share with us what it's like to work in the pediatric setting, specifically in your locale? And how would you compare it with your experience here in the Philippines?
Like we talked about, I can speak in Tagalog.
Yeah.
Yes,
Okay
definitely,
lang,
sir.
lang,
Go
sir.
ahead.
Sorry. Go ahead.
To answer your question, first off, medyo bago-bago pa ako dito sa Australia. So I just moved this January together with my wife. So we're doing a lot of adjustments at the moment. So yung pinakamalayong adjustment namin, of course, is getting employed and learning the ropes, basically, because it's entirely different from what we used to do in the workplace, specifically sa pediatrics. So ibang-iba siya in a sense that yung nag-hire sa amin na company actually makes use of a transdisciplinary approach rather than the usual multidisciplinary approach that we used to do. So if you try to imagine how difficult that adjustment would be, because yung transdisciplinary, hindi tayo na-expose yan eh. Like in our internship years, kahit anong, I'm not sure if you guys were able to have a rotation that's making use of a transdisciplinary approach. So have you, Patrick or Pat?
Personally, when I was in school, tinuturo sa amin yung mga multidisciplinary, transdisciplinary, pero
Yes,
hindi
same.
naman parang hindi naman natin na-apply sa actual work.
Mostly
parang
multi din eh, no?
So how can you describe, sir, yung difference ng multidisciplinary na sa
Yeah.
transdisciplinary? How does it differ?
So, compare ko na lang yung multidisciplinary tsaka yung trans. So, sa multi, very limited yung communication between the professionals. So, for the SP and the OT to talk about yung clients sila, usually very informal, or sometimes they would set time na pag-usapan talaga. No? Whereas sa transdisciplinary, constant yung communication namin ng speech. And then yung part ng team namin consists of speech therapists, OTs, nutritional therapists, tsaka psychosocial therapists as well. So 4 different na disciplines, 4 different professionals would handle a single case, and there would be sessions together. So working together kami. So talagang ang usual session namin sa TransD, nandiyan yung client, nandiyan yung parent, nandiyan yung OT, nandiyan yung speech. So 4 na tao yung nasa loob ng session room.
Right. So you do it all together at the same time?
Yeah, so 1 hour, couple of activities. Pero we have to make sure yung mga activities na yun, matatarget yung goals for SP, matatarget yung goals for OT. So yun yung medyo tricky dito sa job ko dito.
Yeah.
Hindi siya yung usual eh. So like I mentioned earlier, I don't believe yung OTs sa atin were taught how to do that type of approach. So more on talaga multi tayo eh. Especially sa sa pedia, di ba? So yun yung just to compare, that's pretty much it. That's yun yung defining factor between the two types of practices in terms of being in an OT, pediatric OT in Manila or anywhere else in the Philippines, as compared to here, and specifically then sa company na pinag-workan ko.
Okay, thank you, Sir Miguel. How about you, Miss Luna?
Okay. So I can consider myself a newbie here in New York. I just arrived early this year. So I'm a contract OT. So if you're a contract OT, you're under an agency. So my agency has a contract with the Department of Education. So when you arrive in New York, the first thing you're going to get is your social security number. So as soon as you have it, they will give you your schedule for fingerprinting in the Department of Education. Because you couldn't start work if you don't get fingerprinted. That's how they would know that you're official. They would get your name, your basically your license and everything else about you. And then they would give you your caseload. So that's how I started. I got my caseload. So I arrived pandemic time. So classes at that time was still through your Zoom or what you call this, via telehealth. So that's how I started, and I was given a charter school. So in the Department of Education here in New York, they basically in the United States, they have several settings. So you have your private school, then you have your public school, and then you have your charter school. So charter school is basically still funded by the Department of Education, but they're not mandated. They're not regulated by the Department of Education. They have their own. So I have students there that were assigned to me grades 6 and 7. So teenagers basically.
Yes.
Yeah.
Mm-mm. So how about the experience itself in the practice itself? Kumbaga, how does it differ from here sa Philippines? Does it have the same referral system? Yung mga ganun po.
No, because we don't have we basically in the Philippines it's all out of pocket. Diba? And if you need an OT, you need to get an outside OT from the school system, because we don't have a public school where you have an OT, which is something I would really want the Philippines to have. in the future. Because I can see, this was one, in fact, one time, na-interview ako ng the director, and then asked me on what are my plans for my future. And I really said, so many things that I can see here sa US that I would want to bring to my home country. Like for example, having an OT in school, that's very important, especially in the public school system. We see special education, but when you look at the general population of our public school system, and we see a lot of our students like already in grade 7, grade 8, and they have problems with their reading, their writing. That's OT job. That's an OT job, and most of the time, the teachers couldn't even cope anymore because the number of students per teacher, it's just too much. So sometimes when we look into that's how we are here. We have the policy for no child left behind. So every child, whenever whenever they see a student that has a problem, like for example, problems with writing or messy handwriting, that's like all they see. The child has a messy handwriting, refer to OT. That's the referral system here. Or like if they couldn't cope, like they couldn't cope with their math, they couldn't cope with their reading, so they would be referred to OT. So that's how it is. And then they would be given their individual education plan, so their IEP. And that's basically where you would work. So when I started April, and the children or the kids I have had already their IEPs. So I would just basically work on the IEP from the previous OT. So the goal was already in place. So yeah, there. So mostly it's handwriting, mostly working on visual perceptual skills, learning disability. But then a few months after, given another school at 75, that's where the special education are. So I was given children with autism already, and it was curtain. So basically a different whole setting from my charter school. Kasi mga bata to, and they have autism, medyo mas low functioning, non-verbal. So ganun na setting ang work ko dito.
Thank you, Miss Luna. So, you see, that was very interesting to know, no? So, let's move on to our next question.
How do you do your evaluation in your area and the use of standardized assessment tool?
Assessments. Yes. Mostly sensory profile. And yung sensory profile na ginagamit namin dito is online. Online lang siya. So, usually ini-email lang sa parents, and then the parents will do it, and then will just notify us if nagawa na. And then pati yung scoring automatic din. So online.
All right, interesting.
Yeah. Yun yung favorite ko eh. Kasi yun na lang.
Mas madali, sir, no?
Saka personally, gusto ko rin ginagamit yung SP if I can.
Yeah.
Pero,
other assessments, aside from that, yun yung siguro yung pinakagamit for us.
Hindi naman siya, ang other assessment tools parang hindi naman kailangan gamitin. Like,
hindi masyadong ginagamit. Although meron kaming cars, P-body nga wala eh. So, laging sensory profile lang for the road.
So mostly sir, pag nag-i-eval kayo, mostly parang functional eval lang, tapos yung parang kunyari goals sa ADLs, school participation, tapos sensory profile, parang ganun na lang, sir.
Yeah, mostly functional assessments.
Right. So
Okay.
parang in a way medyo similar siya dito except yung sa SP nga. So parang wala nang certification since ganun, hindi na rin naman ginagamit.
Oh.
Yes. Okay. So for you, Miss Luna, nakapaggamit ka na ba ng mga assessment tool dyan sa inyo? Or not yet?
Not yet. Kasi I was working already on a goal that was given. Kasi syempre, they are not my own students. Parang kumbaga naman ako lang, and they were already evaluated prior. But we were taught by our agency, we had a training for sensory profile, yung mga sensory integration is very important sa practice in pediatrics. What else? Basically, yun lang. If also you should beef up on your handwriting tools. So it doesn't have to be the handwriting without tears. I mean, just have a a knowledge, because like for the most part, it's really handwriting. Especially if you're given like mga teenagers, yun yung bibigyan. Sensory usually pag mga bata. Yeah, but you're working on fine motor, like, very, mga pre-writing, ganyan lang siya. Pero wala pa akong ginamit na, formal assessment tools so far.
Ayan, okay po. Bali po, example, but the assessment tools, they are readily available. They are accessible naman po in your school, in ano.
Yeah, actually here in New York, it's already in school. Meron naman, if you really want to use it, it's there. Like it's handwriting with a tears, it's all in the OT room. If you want to use it, it's there. Yes. But because in Chicago, because I applied also before sa Chicago, they have it's free for public school teachers and OTs. You can have a free certification for that. But in New York, parang hindi ko pa but it's there. I just don't know if it's a free certification. You have to buy it or you have to get it yourself.
Is it covered po by the school, or yung in terms of certification, acquiring certification?
Yeah, it's like SI, ganun, parang hindi. I don't think so. I think you have to have like if you want to be certified sa SI, I think you have to have your own. Parang ikaw magbayad. I think it depends sa state. Depende siya sa Department of Education ng per state.
Very, very interesting. So, but it's still, even with the other assessment tools, there are free certifications that you have to attend to utilize them.
Yeah, yes.
Thank you, Miss Luna.
For the next question, can you tell us about intervention planning and implementation in your area that may be similar or different than that of in the Philippines?
Actually, what we have is the IEP plan. It's we have the IEP meeting with but I only attended once kasi nga may in place na yung iba. But I attended once. It's with the different related services, as the teachers there, the mother is there, or the parent, the other related services, the speech, the PT, the OT, and we would be talking about the goals for the child. So basically, that's our intervention planning already. It's not very formal, just basically what the child's problem is, what is your goal, and what is your plan on how to reach that goal. Parang ganun lang siya. It's basically, ganito din siya, parang usap-usap lang. It was over the, the related, we were all in a classroom, but the mother was via Zoom. So, ganun lang siya ka-informal. So,
right. And then
we were just like, they would ask, like, so OT, what is the problem that you would want to work in OT? Kasi dun ka gagawa ng goal. Based on the problem na nasabi ng teacher, nasabi ng mom, basically what the mom wants, kung anong tingin niya problem ng bata niya. So, ganun siya.
Right. When it comes to making goals po, will it, or it depends po sa discretion nyo na lang po? Are you more focused po on bottom-up or top-down approach? Or what kayo po?
Bottom-up.
Is this because of yung sa insurance companies po, they want to see progress, and through that, bottom-up po talaga dapat? Or is there another reason?
Actually, sa school, it depende siya talaga sa OT. Actually, minana ko lang yung IEP, so finalo ko lang siya.
It's okay.
But sa school kasi, hindi siya, ang insurance ng school is Medicaid. So, unlike with the SNF na talagang they're very particular with the progress. Dito kasi sa school, ang minsan ang bagal na makikita mo yung progress. Ito pa pala with the school system, they're very particular about kung anong anong style mo. Like in the charter school, they would really want the least restrictive. Like ayaw nila yung pull-outs masyado. So for the most part, push in ka talaga dun ka sa setting talaga ng classroom. Hindi mo sila kukunin, and then, but in the District 75, you can pull out. So, ganun siya.
Right. So ano po, so talagang more, you have to adjust po sa mga kids po para mag-improve po sila and more. Siguro yun nga po yung plan po na nakuha po ninyo from the previous OT, more focus po sa bottom up talaga. So sa skills nila specifically, siguro yung handwriting, right?
Yes.
Yes. Okay.
Or
All right. How about you, Sir Miguel?
When it comes to planning, usually our senior OT will do the initial interview, and with the initial session, that's where she conducts the assessments, parang yung IE. Tama ba? IE?
Yes, I.
Naalala ko pa naman. Okay, so yung parang in-IE na niya yung client, and everything is shown on the database. And then from there, it's up to you how you're going to tackle yung intervention. So you don't need to write an intervention plan with my workplace. You just follow the given information. Usually outline na din yung goals. Like this is the priority goal of the parent, ganyan. So it's up to you how you would like to prioritize it. Kasi we do prioritization of goals, diba? Depende kung ano yung kailangang unahin para matakal yung mga next goals niya, di ba? So, it's up to you kung ano yung prioritize mo. And just, yun lang, follow through mo lang. Follow through mo lang dun sa, paggawa ka ng plan mo for the next session, and so on and so forth. And sa amin, collaboration talaga. So,
with the other therapists, sir, no?
So, ayun, mostly mga collaborations namin, we have to find spot in our schedule. So marami kami mga meetings together with mga ibang
talk about your client, right?
Yeah. So we bill yung time para mag-meeting kami. We bill lahat hanggang sa paggawa ng na mga visual aids. Yun, binibill namin lahat sa clients. So kahit meetings, anything, basta bawat kilos may bayad.
Right. Thank you, Sir Miguel. For our next question, describe a particularly difficult challenge that you've had with a child and how did you handle it?
Okay.
In
Lahat
terms of
naman
experience.
Kasi in terms of experience, yung pinaka-challenge ko talaga is this child. Actually, na-sprain yung wrist ko sa kanya kasi every time kasi pull out. So I would bring this child but this is like 7 years old, 6 years old, but he's tall and he's big. So every time na dalhin mo siya sa OT, he's fine, but he's hyperactive. Pero once you say, we'll go back to the classroom, oh my gosh, magro-roll na yan siya. Ayaw na niya talagang bumalik sa classroom kasi he thinks that OT is like fun, nag-enjoy siya, ayaw na niya. So kakargahin mo, kinarga ko talaga siya all the way, every single time. Parang nakakapagod din. So, yun yung pinaka-challenging. But the one na pinaka-challenging din for me, yung sa through telehealth na yung grade 6 na bata. Kasi he doesn't want to do OT most of the time. He just wants to sleep. Kasi yung time ko for him is after lunch. Kasi yun na lang yung available ko. Kasi syempre meron pa akong school na iyon. So after lunch na ako pwede. Yun yung time na gusto niya matulog. So every single time umiiyak siya. So parang yung 30 minutes ko session, 20 minutes crying yan, 10 minutes na 10 minutes na activity, 20 minutes crying. Yun yung sabi ko, for 20 minutes. So, yung mga challenges. And also, mahirap siya talaga. And ang expectation kasi, ito talaga, ang expectations ng tao sa OT, mataas. The teachers, they don't care if wala kaming ganito sa school. We don't have CCs. Ang system kasi namin, we have what we call CCs. So everything's online. And andoon yung IEP, andun yung documents ng bata, andun yung progress niya, progress reporting mo doon. Every single time that you see the child, you do your reporting there, your daily notes. So it's what we call it's a website ng Department of Education. So they would think you know that already, and you don't. parang,
Mm-mm.
and the agency will just train you like probably half a day and expect you to know everything. So yun yung challenge because you have to be fast. You have to think like, parang you have to, what's the term? Parang you have to fall running. Parang ano ba yan? Parang you have no honeymoon period. Dapat pagdating mo, run ka na kaagad. Kasi hindi mo pwede sabihin, I don't know that. And when you're assigned a school, then they would interview you. So dapat, syempre, marunong ka na sa mga terms nila dahil iba yung set. Wala nga tayong IEP, wala tayong, di ba? Wala tayong no child left behind policy, wala tayong. So ang dami. So you would be like, okay, ano ba itong pinagsasabi nito? So okay na ako. Pero you have to be honest that you're not very familiar, but you're willing to learn, ganyan. So those are the challenges of a new OT dito. Kasi ang iba sa system natin sa Pilipinas talaga.
It's good po kahit pa paano, no, na even if hindi niyo po alam initially yung kunyari yung sa IEP, yung left behind, they were willing to teach you po. Sana po sa lahat
no, nobody will teach you. Ikaw talaga lahat.
How did you learn?
Willing to learn.
Even if when you log in, alam mo yung meron akong classmate kasi I graduated 1998. So meron akong mga classmates that were already here prior, matagal na here, mga almost 20 years na rin dito. And working sa school setting din. So those people, yung mga classmates mo na nauna, they're very helpful. I would call often, minsan like, I have a question. Minsan like, teka Luns, meron din akong pasyente na, sige, I'll call you back. So, sila yung source ko of information. And also, I have a very helpful supervisor sa agency ko. So, every time, tawag ako ng tawag, minsan feeling ko, baka naiinis na to sa akin, baka nakukulitan na sa akin. But you really just have to ask. Because when you're new, hindi ka rin pwedeng magawa-gawa lang. So, tsaka, pero most of the time, pag binigyan ka, kuha mo na kaagad. Pag sinabi na sa'yo na etong gagawin, you write it down kasi parang pag hindi mo alam the following time, parang maiinis na sa'yo syempre dahil tanong ng tanong to. So, ganun. So, you have to be quick. Ganyan lang.
So, it's very important po talaga, no, na meron po tayong support system when we're there. Kasi nga po, without them po, hindi nyo po talagang matututo yung tungkol sa IEP, yung no child left behind. Tapos mahihirapan lang
notes,
po.
mga even how to write down notes, like, ay, anong ilalagay ko dito? Wala naman kaming ginawa masyado. Parang ganun yung first ko na, ano ba yung ginawa namin kanina? Parang, so, syempre, paano mo siya i-write down? Tapos yung, when you make your goals na smart, syempre, although sanay tayo na ganito yung goals natin, syempre, pero iba sa school. Iba sa public school, iba yung gusto nilang goals na sa pediatrics natin, wait, the same naman ang goals natin. Pero more sa school setting kasi talagang for school siya.
Right.
'Di ba? Minsan kasi sa atin dahil wala ang pediatrics natin most of the time is outpatient sa so iba din yung tinitingnan natin. So eto more sa school setting yung mga goals talaga.
Opo, so yung occupation na focus natin talaga more targeted sa school. So sinasabi niyo po less po yung focus sa ADLs, etc. Yun po ba sinasabi?
Yeah. Although ipapasok mo ang ADLs when toileting.
Okay, yes.
Yung nga, mabigyan ka ng bata na pag like may bata ka sa kinder, syempre kasi hindi pa naman masyadong magaling sa toileting yan.
Yes.
So ipapasok mo. But let's say, bigyan ka ng teenager like grade 6, grade 5. Alam na nila yan. So ipapasok mo talagang mga handwriting na yung mga very specific, even very specific goals kasi gusto mo makita yung progress para may ma-report. Ang reporting dito ng progress is every 3 months. Yung progress reporting. Pero may school na every month din. So, kung hindi specific yung goal mo talaga, like, if it's very vague, very, like, although alam naman natin goal natin is SMART, so specific siya, but if it has to be very, very specific so that meron kang i-report. Kasi pag medyo vague siya, after 1 month, anong i-report mo doon na progress? Diba? So, ganun siya.
Thank you, Miss Luna. I think Sir Miguel has something to share as well.
challenge. To be honest, medyo na-shock ako sa mga first couple of days. Because I would read yung patient files, diba? That's what we do. We have to know yung client natin bago natin sila makita. So I would read, the client has autism. And then I would meet them. And then parang wala. As in, parang mga question mo, paano nagka-diagnosis ng autism itong child na to when in fact, ang ganda ng skills niya. So,
Right.
yeah, you'd be surprised like how high functioning yung mga individuals dito. As in, it's quite rare for us to have clients with a high level of autism. So, a lot of high functioning clients. And siguro yung most challenging would be, oh my gosh, wait lang. Most challenging. Probably, yeah, a client that I have na high level autism siya. And then, ang ka-team ko dun sa client na yun is my manager. So medyo,
Wow.
andun yung speech kasi yung manager. So andun yung pressure, guys. Parang, talagang medyo high level yung autism ng child. Tapos sinisipa-sipa siya, sinutok-suntok siya, nagwawala, ganun. Pero,
Yes.
Pero high level pa rin to, no, sir? Pero nananakit pa rin ka?
baliktad kasi sa atin. I don't want to use kasi yung term na low functioning. I don't want to use that. So,
No problem.
when we say high functioning kasi ay high level of autism dito, ibig sabihin siya yung low.
Okay.
Long levels
Okay.
kasi dito. So, ASD 1, 2, and 3. So, usually 1 yung mga high functioning, 3 yung medyo maraming stems.
Okay. Kumbaga baliktad pala, sir, no? Parang baliktad yung terms na ano.
Yeah. So,
Okay.
yun non-verbal, maraming stems. Medyo aggressive din. And then yung ka-session ko nun is yung manager namin. So, medyo nakaka-pressure siya. Siguro yun yung challenge. So, our first session, medyo pares kami. Parang nawindang kami. Pero,
Of course.
Oo nga. Opo.
Very fresh pa ako dun sa job as in like I'm the new guy. So, lahat ng mata nasa akin.
Opo.
So, that first session, I didn't do much at all. Kasi first time ko makahandle ng gano'n.
Siguro nag-observe pa kayo, sir, no? Parang tingin mo na, oh my gosh, ano kaya ito? Ganyan.
I-English niyo pa siya.
Yes, sir. Plus English pa, sir.
Tapos yung daddy na nandun din during the session. So siya din.
Nakaka-pressure naman.
Oo, nakaka-pressure talaga siya. Tapos, next session, yun na, plinan ko na. Nag-adapt na ako ng mga tutunan natin dyan sa Philippines. And then, biglang nag-participate na maayos yung client. Best session ever daw nila.
Wow! Iba talaga.
Galing, sir.
Guys, simple lang yung ginawa natin. Simple lang.
Opo.
Principles lang talaga na SI. So, ayun.
Okay.
Na best session ever siya. So,
wow. Sana all, sir. Okay. So, sir, I would like to ask, what do you think is a parang particular strategy na usually ginagamit nyo when you work with other children? Kumbaga yung parang go-to strategy nyo.
Yes. Like I mentioned kanina sa example ko, syempre, kailangan may SI tayo. Pero ang pinaka-tricky dito, bawal mag-BMT.
Okay.
You can't say no to the kid. Tayo, diba? Pag nag-BMT tayo sa Philippines, no, we have to be firm. Dito bawal yan kasi there's such thing as restrictive practice. So technically, you can't parang restrict yung mga kids. Hindi mo sila pwedeng harangan. Hindi mo pwede i-lock yung room and stuff like that. So pag may BMT, bawal siya. So,
Mm.
yun yung tinatry ko tanggalin. Doon pa ako nagsastruggle at this time. Kasi pag naging behavioral na yung client ko, initial reaction dyan is, di ba? I-turn on yung kind firmness natin or matter of fact.
Yes.
Yung TUS natin. Bawal siya gawin dito. So, yeah. I have to be very careful with that one. So now, pag nagiging behavioral yung client ko, na-freeze ako. Na-freeze pa ako. And I would watch yung sessions ng supervisor ko. And then she does the same. Like,
Nag-repeat din siya?
ganun din. Ganun din kasi bawal mag-BMT. So yung medyo tricky dito sa practice sa Australia.
Right.
They have that thing called restrictive practice. So you can't do certain things na negate mo yung gustong gawin ng child.
Right.
So,
Ang hirap pala, sir, no?
hirap.
Very difficult.
Yeah.
Lalo
So,
na pag nakasanayan.
Oo.
Na BMT is part of the practice na parang, kumbaga, kasali na yun automatic. Tapos ngayon biglang, okay, I have to restrict myself.
Yes, so ang nagiging approach ko na lang, so we have to adapt. So what I do, na lang, house rules na lang. Like if
yes, okay.
nare-redirect ko na lang yung client sa house rules.
Yes.
Yeah, so kasi sometimes it works, sometimes it doesn't. Pero ngayon, ang approach siya, syempre, develop talaga ng mga skills. So, a lot of the ADLs.
Right.
A lot of handwriting. So, that's pretty much it. And then, mostly naman, tulad din sa atin, ng primary goals, magsalita yung anak nila. Yun yung mga gusto nila dito. So, it's
Truth.
ganun lagi eh. Apparently, dito ganun din.
Yung wife niya naman siguro, sir, magaling mag-English, no? Kailangan maturuan niya yung mga kids na magsalita.
Speech siya eh.
Ayan naman. So, yun naman when it comes to intervention.
What are your tips or recommendations to our fellow Filipino occupational therapists working in the pediatric setting in the Philippines?
Tips. Tips ba? Tips?
Yes,
Yep. Or recommendations. Or kahit ano, sir.
Right.
Advice.
Probably, trying to think of a good one. Just keep doing what you're doing. Do it with passion. Do it with heart. You're changing lives, so always keep that in mind. And just have fun in the process as well. Wag puro work. Mag-chill din kayo. Like,
Tama.
Patrick, chill daw.
Wag puro work. Dito bawal ma-stress dito. As in, work-life balance here in Australia is immense. Like, it's up there. Like, people from work noticed me one day looking kind of tired, and then they go like, "You look tired. You have to take a leave."
Wow. Yes.
Yeah. They are very big on the work-life balance thing. So it even shows in my contract, like I have forced leaves, like I have to take them. And then, by the way, I only have a 4-day work week, Monday to Thursday.
Wow.
Yeah. So
talagang work-life balance, sir.
So imagine nyo, 3-day ang week, 3 araw ang weekends mo every week. So,
wow.
Yeah.
I know about 4-day work week, sir. Pero the thing is about 4 work weeks is you get is the pay equivalent to a 5-day work week? Ganun, yes. Or medyo may
they really value the life outside work, kumbaga. No, kasi talagang may oras. Yes.
Like,
okay.
With my workmates, they would just take a leave whenever they like. And then that's it. They get paid.
Wow.
To be honest, sir, ganyan din ako. I take a leave when I like, pero the thing is, I don't get paid for it.
Exactly, Patrick. High five.
I know how that feels. I was like that once. So I was like that all the time. So yeah, coming here and experiencing your work-life balance is really, really nice.
All right. So ano po, for our next question, we'll be asking you an audience question po. A question from our Facebook likers dun sa spOTlight Facebook page natin. Please, for our listeners, please follow our Facebook page at facebook.com/spotlight CDUMAOTB21. So the question that I'm going to ask to you, Miss Luna, is from an OT in Metro Manila. And his or her question was, what is the trend of OTs practicing pediatrics in your country?
Trends.
Trends po, sabi niya.
Trends.
Baka may nagsa-stand out sa'yo.
Trends. Actually, dahil bago pa ako, kaya hindi ko pa rin alam kung ano yung trends ng... Saka school lang talagang alam ko. So, ano ba yung trends nila? Hindi ko rin alam pa eh. Alam mo, with the school setting, hindi mo masyadong makikita yung ibang OTs eh. Kaya,
lalo
parang
na po
may
during
sarili
the
kang
pandemic,
mundo.
no?
Kasi, di ba,
Kasi,
oo, tsaka kahit
distancing
nasa
din.
school setting ka, wala ka namang kasama na ibang OT. Unlike in a center na marami kayo, nakikita mo
Right.
yung iba. So for the most part, you're working on your own talaga. Talagang, kaya hindi ko masyadong makita yung ibang wala akong nakikita ang OTs na iba. Sa school lang.
Opo. So mostly po yung mga interventions na ginagawa niyo po, very similar lang po sa how we do things here, and especially sa handwriting.
Yes.
Right.
Yes, very similar. Yung mga sensory, handwriting, very similar. It's just that yung approach lang. Kasi nga, sa ating center mostly, di ba? Dito talagang, if naka-breakdown siya, if it's early intervention, if it's school-based, if it's, meron din silang outpatient na pediatrics, iba naman din yun, pag more on the medical naman yun. So, ganun siya.
Right. So, I think that answers our question naman po. For the last two questions, we have two more questions. Kat?
Okay, so at this point, we would like to ask you, Ma'am Luna, what are your tips or recommendations to our fellow Filipino occupational therapists working in the pediatric setting here in the Philippines?
Guys, I really salute you because it's difficult. If pediatrics is a very difficult field na pasukin. Because, kids, they're lovable, but they're difficult to work with also, di ba? You need to, sometimes when I talk to my patients in Nigeria, and I would tell them na, I work in the school, and then my Nigeria patients would say, oh my gosh, your patience is amazing. I can't believe, because, if you're working with pediatrics, you have to have a lot of patience. So, kasi ako, when I was in the Philippines, I never had clinical. I was just in the academe. So, it's difficult. What we're doing, you're on the right track. Follow your dreams. Kasi, if you really want to pursue pediatrics, is very, very, rewarding. Not only financially, but, when you see a child, like, nag-graduate sa'yo, dinischarge mo na siya kasi tapos ka na sa goals mo. Ano pa bang gagawin ko? Tapos na ako sa goals sa kanya. That's rewarding when you see the child. Kasi I asked my child, what do you want? My children, I call them my children. Yung sa mga bata. What do you want to be when you grow up? Tapos meron kang learning disability and would say, I want to be a lawyer. Di mo pwedeng sabihin, oh? So parang ganun, di ba? And then, magmagawa niya talaga yun. That's, you can really say na, it's something, somehow a part of that dream was because of you then. Yes. You were also part of that dream.
I really agree. Yeah. It feels very rewarding to become a pediatric OT. And then we deal with many different children with different ages. So parang very fulfilling for our part, especially when we see them achieve the goals.
Right, Kat. So, Sir Miguel, can you answer our last question, in which we want you to share with us how can you describe your experience working as a pediatric OT in your area in one sentence?
One sentence para describe? Tama ba? Yung practice dito? fulfilling.
parang summary. Yan.
It's a very fulfilling profession, even though I'm here in a different country. It's fulfilling in a sense, like I mentioned, you get to balance both work and life and have leisure time for myself and with my wife. And it's not all about work. It's also about having fun and changing people's lives. So that's pretty much it. Yeah.
Very,
And
very inspiring. we hope we hope eventually the practice here in the Philippines gets to that level na
Mm-mm.
I wish and I pray. Yeah.
Kaya sana talaga na dumating tayo sa point na kahit dito, prioritize na yung work-life balance. Pero at the same time, yun nga, we get to improve the lives of our patients, do the best.
Yeah.
Yes, agree.
Sana may balance yan.
Agree.
Just,
Okay.
can I share just one more thing? Like,
Sir, go ahead.
Yes, sir.
like it's quite inspiring actually. I think it's the highlight of my entire career. Just happened a couple of weeks ago here.
Mhm.
For the first time ever, I've been told by a parent that what I taught her in the previous session actually changed their lives. So that was
Wow.
exact words. So that in itself is very inspiring. Like for me to experience that 8 years from when I started in a different country, that gave me, kumbaga, yung perspective na what we do is as OTs or something really special. So, for everyone listening who are also OTs and doing their own thing, yeah, just keep doing it. You're doing a great thing. You'll get places one day, and yeah, it's a great job. It's a great job.
Wow. Thank you, sir. Thank you, sir. That was very inspiring. So, how about you, Miss Luna? Can you summarize your experience as a pediatric OT working in New York in one sentence?
Okay, it's fun, rewarding, and challenging, but I wouldn't have it any other way. Okay, that's it.
Yan. Thank you.
Thank you
Thank
po.
you, Miss Luna.
That-
Okay.
That was a very wonderful answer. Na-inspire po ako.
Pang Miss Universe. Yes. Okay. So today we talked about the different experiences and evaluation process and intervention planning implementation in New York and Australia. Somehow, no, there are differences. Like in Australia, they practice a transdisciplinary approach and are focused more on sensory integration because they have what they call a restrictive practice. So they cannot use behavioral modification techniques. So in New York naman, they usually use a bottom-up approach and they follow an individualized education program or IEP for the OT practice in the school setting. Other than that, somehow the techniques are similar naman to here in the Philippines. So everyone, I would like to thank you for participating in this episode. We definitely learned a lot from you guys. Oh, ikaw ba, Patrick? What's your key takeaway from this episode?
Of course, Kat, for sure. Ang dami din talaga ako natutunan in today's session, in today's episode. And I hope our participants as well, our participants and our listeners. So my key takeaway from the discussions that we had today is that occupational therapy as a profession is amazing. It has many challenges, not only sa Philippines, but also sa different parts of the world. Pero sabi ng mga participants natin, pareho sila na it is very fulfilling and it really does have an effect on the lives of our kids. But one more thing, another important point that we really should be doing, applying to our own lives, is to maintain a great work and life balance.
True.
Not just for our sakes, hindi lang para sa atin, pero syempre, para sa mga bata natin, sa kids natin.
Ayan, tama, Patrick. You're definitely right about that one. So that wraps up our Spotlight episode. We would like to thank Claire on air of Y101 FM Radio for giving the podcast a shout out. Catch her set on Y101 FM every weekend from 8 a.m. to 10 a.m.
Thank you, Miss Claire. By the way, Miss Claire Cordelia is also in the running for Miss Philippines Earth, representing her home, Lapu-Lapu City. So please, guys, check out yung campaign niya and give her a vote.
Tune in for more content of spOTlight and the future projects of Cebu Doctors University Master of Arts in Occupational Therapy.
Please like and subscribe. Hit that notification bell button to make sure that you don't miss any of our upcoming episodes here on YouTube. This is Pat.
And this is Kat
And this is spOTlight.
on air. Thanks for listening, everyone.
Thank you, everyone.